This is special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal.
And welcome inside more special COVID-19 coverage on the Your Health podcast, available on all your favorite platforms, as well as ciusswestcentral.ca/podcast. That's CIUSSS westcentral.ca/podcast. I'm your host, Sean McMahon, and listen anytime and be sure to subscribe too, so as not to miss any new episodes as we continue to take a tour of the various corners of CIUS West Central Montreal. So these days, cleanliness is key, and the mere thought of what lays on a surface is enough to give us pause. Think about what you may be doing to stay clean and sanitized and safe in your office or even your own home. Now, just think for a moment what those simple tasks look like at one of the busiest hospitals in Canada during a pandemic, where it's actually a life and death situation. Anthony Turi is the head of environmental services at the Jewish General Hospital, and he's our guest on the Your Health podcast. Anthony, hello.
Hi, Sean. How are you?
Doing great. Thanks for joining us. You've got quite the job on your hands, let me tell you. And as I just mentioned, right, everybody's cleaning and sanitizing habits, they've changed just in their own home. I want to know how you've handled the very demanding task of cleaning and maintaining and sanitizing a hospital in the middle of a pandemic, and maybe how it's different from just a few months ago.
Yeah, well, basically, Sean, I think it's sort of a mixed bag of what it's brought towards us. In many ways, our staff is already highly trained to deal with various outbreaks which occur in the hospital setting. So our overall approach served as a solid base for the current pandemic. But what's different now is the sheer size of the outbreak, I guess. The number of confirmed cases, but also the number of suspected cases, which are present pretty much all over the place in the hospital. That's what changes it. But at least our protocols, like I said, served as a solid base to what we already have in place. And we just had to expand a little bit up on it. Our teams deal with outbreaks on a regular basis of various kinds. They don't necessarily get as much media attention as this pandemic, or the context is a little different. But once again, the sheer size of this and the amount of staff that we've had to add in order to cope with the demand is quite astounding and unprecedented, I think.
Let's talk about those approaches maybe, if we could, for a second, because okay. I'm curious, because I don't know the answer to this. How do you, for example, clean a room where there's a COVID positive patient?
So the protocol calls for a standard cleaning of all surfaces with hospital-grade disinfectants. This includes walls, curtain changes, but it's also followed by a vaporized disinfection with hydrogen peroxide and silver nitrate. It's something that we do for certain other types of outbreaks or highly infectious bacteria, but it essentially serves the same purpose. So it fumigates the room. So even if there's human error and we've missed, let's say, a surface after cleaning it, the vapors get to every little crook and cranny within the room and actually eliminate all the bacteria. Depending on the type of room, you could have different ventilation setups. You have a positive pressure room, you have a negative pressure room. So when it's a room, let's say in intensive care, that has a lot of aerosolization type of procedures happening, then it is a negative pressure room. And once the patient is discharged, we don't enter the room until the right number of air exchanges have been achieved. And then that's when the room has been freed of all the contaminants in the air, and then it's safe to enter afterwards. So these are all very intricate systems which are controlled throughout the hospital. There's newer wings, older wings. That changes the amount of time you might have to wait for entering the room. And once those air exchanges are done, then we can begin our process of
There's a lot of factors.
Yeah,
there's a lot to
factors,
consider.
sure.
And stuff changes so quickly, too. I mean, depending on who you talk to and what department, that's one of the challenges of this whole pandemic, is that things change not on a daily basis, but they change on an hourly basis, and sometimes by the minute.
Exactly.
Listen, one of the things that I love in being able to do the Your Health podcast is that I get to speak to so many different people, from CEOs to department managers to, literally everybody. And the thing that I've been able to surmise is that there are so many heroes doing incredible work at a really difficult time. And you and your team, you kind of work behind the scenes, maybe in the shadows a little bit, but your work is invaluable, clearly, to the safety of the staff and the patients every single day at the hospital. I guess what I'm asking is, do you really realize how important you are as a team?
Yeah, definitely. I think we do realize it, and we remind ourselves regularly, because sometimes we join meetings where you look at the agenda and, we're involved in, as you can imagine, every clinic's affairs, every patient ward, every department relies on us because we clean every square foot of the hospital. So when we enter these meetings, many times housekeeping is sort of either last on the agenda or one of the final things. But the more these meetings advance, you realize that more and more the conversation turns to environmental services and what are the different protocols that are going to be adapted and communication and different things like that. So we definitely have we understand how important we are in the chain. And I think sometimes we, as managers, also have to make sure that our staff is on board as well, because it is a large team, right? At the Jewish General alone, you're looking at close to 150 different job routes. Basically, the whole hospital has been divided into various sectors. You're talking about 400 employees altogether that cover these sectors around the clock.
It's a lot.
We welcome the challenge. At the same time, we care about our families and we want to stay safe.
Well, I'm glad you brought up families because you mentioned this to me off air, and I hope you don't mind me bringing it up on air. But, a lot of you do have families to go home to. And in your case, that's a newborn baby to go home to. So congratulations on the growing family. That's just great news. Listen, last question for you, Anthony. I want to know the one thing you think we should know about environmental services. Maybe the one thing we just never consider.
I guess the best way to put it would be how much we rely on technology. So if you ask yourself, how do you ensure that all areas are covered in such a large hospital, or how do you make sure that the right equipment and chemicals are being used? What systems are used to ensure that all the bacteria is eliminated? How do you monitor quality afterwards? How do you facilitate communication? And all this is really technology-based. I mean, we could talk for hours, probably, Sean, going into the details of each one of these, but there's technology everywhere you turn. It's no longer that old approach of, some nasty old bucket with mops and rags that are used to clean the surfaces. And, we're far, far from that. It's so much more than that, especially in healthcare. Yeah.
It's fascinating. I mean, that's what we're learning through this whole process as well, is that we're also learning on the fly to use the technologies that are available in ways that maybe we hadn't thought that they might be helpful and critical in some cases. So it's fascinating stuff. And I wish you guys all the best. Shout out to the entire department for doing what is being done on a daily basis and, like I said, an hourly basis, because it really is an enormous task. Anthony Turi, Head of Environmental Services at the Jewish General Hospital. Thanks for everything. Stay safe and best of luck going forward. Appreciate you being a guest on the Your Health podcast.
Thank you very much. And I'd like to take just the opportunity to thank our team as well. They've done a great job, and keep it up, everyone, if you're listening.
You've been listening to special COVID-19 coverage on Your Health, a podcast of the Integrated Health and Social Services University Network for West Central Montreal. Don't forget to subscribe at ceuswestcentral.ca/podcast or on your favorite podcast platform.